Good morning. This is the third part of the final revision video, and we are gonna discuss further points or other points related to conjunctival infection. Now, I might ask you, there are certain organisms, despite all these barriers, the mechanical and the chemical barrier, there are organisms that are capable of infecting the conjunctiva. Justified. So if you get this question, then the answer will be definitely that those organisms can overcome the chemical barrier and the mechanical barrier. How can they overcome the mechanical barrier? They overcome the mechanical barrier by strongly attaching to the conjunctiva. So they have special strategies to attach to the epithelial surface of the conjunctiva. And the second reason is related to lysozyme. They can withstand the chemical barrier or overcome actually the chemical barrier because they can resist destruction of their cell wall by the lysozyme enzyme. Again, another concept that is related to conjunctival infection, as we said before, if conjunctival infection occurs, the predisposing factors would be. I might ask you about the predisposing factors. This is a bit different from the characteristics of the organisms that are capable of infecting the conjunctiva that we have just mentioned before, capable of overcoming the mechanical barrier by attaching strongly, and capable of overcoming the chemical barrier by resisting destruction by the lysozyme enzyme. This is an answer to justify why these organisms can overcome the barriers, or can cause infection actually. But there is another more extensive or more inclusive question, which is, what are the predisposing factors that result in or that help conjunctival infection? So the predisposing factors are the factors that help conjunctival infection. And these factors are partly related to the organism itself, the ones we have just mentioned now. And the best example for this is Neisseria gonorrhea. And gonorrhea is a venereal disease or STD. And Neisseria gonorrhea is the causative organism. It causes infections in the urogenital tract, and at the same time, it causes conjunctival inflammation. But there are other factors related to the conjunctiva itself. So if there is decreased lacrimal secretion, then the conjunctiva would be dry. Then we wouldn't have the liquid film of tears. And if we don't have the liquid film, then we are missing the mechanical barrier and the diminished trapping and washing away of microbes. And we are missing the lysozyme enzyme destruction by the bacterial lysozyme destruction of the bacterial cell wall. Now, if a mom is infected with gonorrhea, then the baby might have a gonorrheal infection of the conjunctiva. That's why we always give, in addition, of course, to examining the mom before labor or birth, we always give prophylactic eye drops. Prophylactic means protective, and eye drops are antibiotic eye drops that are broad spectrum antibiotics that can cover a wide array of microbes. Just because there is the risk of infection while the baby is going through the vaginal canal. Concerning the urinary tract, of course, there are normal flora living in the urinary tract, but these flora are minimal, and they usually cause no diseases, and they usually cannot flourish in the urethra or the lower part of the urinary tract, so that urine is usually sterile. So I might ask you, justify urine is usually sterile. And it is usually sterile because of mechanical protection in the form of downward flush of urine that prevents ascending infection. And ascending infection means infection by microorganisms ascending up the urethra. Where do these ascending microbes come from? They come from the skin around the urethral opening and the skin around the anus or the rectal opening, meaning the skin of the perineum or the perineal area. And this skin usually carries flora, but this happens mostly when there is lack of proper hygiene. So we have two means of protection of the urinary tract, the mechanical one, which is through the downward flush with urine that prevents ascending infection, and we have the chemical protection. Why is urine chemically protected, or the urinary tract chemically protected? Because urine is slightly acidic. It has a slightly acidic pH lower than 7, and this slightly acidic pH is unfavorable for most of pathogenic organisms. And now we come to the vaginal microbiome. And the vaginal microbiome includes a multiplicity of microorganisms that consider the inner vaginal lining as their normal habitat. Usually we have an organism, a friendly flora called lactobacillus in the vagina. And usually we also have, even before puberty, minimal glycogen stores in the wall of the vagina. What is glycogen? Glycogen is a complex carbohydrate that can be broken down by bacterial enzymes into, or even broken down in the digestive system of human beings into glucose, and then further broken down to give rise to energy. So glycogen is a source of energy for lactobacilli. So even before puberty, lactobacillus is there in the cavity, and we have glycogen inside the cells of the mucosa of the vagina. So I might ask you, what happens at puberty in a female? Or I might ask you, why is there an increase in the acidity of vagina at puberty? Or I might ask you to justify the increased protection of the vagina at puberty. So since I'm talking about puberty, you have to start by hormonal surge. And since we are talking about a female, then it is a female hormonal surge. Which kind of female hormones? We have estrogens and progesterones. No, it is only or mainly estrogen that protects the vagina, because when there is an estrogen surge, this is where we start. When there is an estrogen surge at the beginning of puberty, then the levels of estrogen hormone in the blood rise, and this leads to an increase in the amounts of glycogen that are stored in the muscles in the wall of the vagina, because the vaginal wall is muscular. This is good news for what? This is good news for lactobacilli, because glycogen is food for them. So lactobacilli start to break down glycogen in an anaerobic way, which is acidic fermentation, to produce a small amount of energy and to produce lactic acid. So since glycogen stores increased, then lactic acid, which is a breakdown product of glycogen, will increase. Is it useful for the vagina at puberty? Yes, because this acidity of the vagina will kill microbes, will kill pathogens, especially the fungus, the unicellular or one-celled fungus, which is Candida albicans. And now we come to the oral cavity microbiome. Of course, the first famous question is, why is the oral cavity a good habitat for flora? This is because it's warm. This is because it's moist, and at the same time it is dark, and it is full of mouth debris if the person is not taking care of, or persons are not taking care of their mouth hygiene or oral hygiene. So what do lactobacilli, for example, or friendly flora in the oral cavity take from us? They take home shelter, and they take food from the remains of food that are present in between the teeth. But at the same time, these bacteria in the mouth cavity, just like any friendly flora, are useful. They produce fatty acids, they produce like all kinds of organic acids and vitamins. They occupy space. But unfortunately, if the food debris in the mouth are significant, then if there is bad hygiene, then the part of the fatty acids produced are lactic acid. Why? Let's first see what flora are present in the oral cavity. I might ask you to give examples. So the examples are lactobacillus, P. acnes, streptococcus, and staphylococcus. These are the 4 types of bacteria that are present in the mouth cavity. The most dangerous of them is lactobacillus. Another question is, when do we acquire the flora in the mouth cavity? We acquire them at the beginning of life when breastfeeding begins, because when the baby suckles, then all the flora on the nipple of the mom and the skin of the breast of the mom will be transferred to the oral cavity. Why do we say that lactobacilli are the most dangerous? This is not on the slide, but we said it several times, and it is present on the following slides, because lactobacillus will break down the food debris to get energy in a process of anaerobic respiration called acidic fermentation that results in the formation of lactic acid. And so what? Why is lactic acid harmful? Because lactic acid is harmful to the teeth. Lactic acid causes dissolution or dissolving of the calcium salts in the enamel of the tooth, in the outermost hard layer of the tooth, resulting in dental cavities. And those dental cavities might extend from the outermost layer, which is the enamel, to the middle layer, which is the dentine, and then to the innermost layer, which is the pulp, and become extremely painful to the patient. And at that time, the patient would definitely seek medical advice. Now, why are oral flora beneficial? Just like any other flora, they occupy space, and therefore they prevent colonization by pathogenic bacteria. They produce vitamins. And by the way, these 4 benefits are not only the benefits of lactobacilli and oral flora, but they are the benefits of all friendly flora in general. Did I say beneficial effects of lactobacillus? Yes, because as long as you don't have food debris in your mouth, the presence of lactobacillus is beneficial. When could it be harmful? When you have plenty of food remains in your mouth and lactobacillus starts breaking them down and producing lactic acid. But it is worth noting that lactobacillus is essentially a friendly flora. So they occupy space, they produce vitamins, and they do 2 important actions that are a bit more difficult, which are cross-reactivity and microbial antagonism. Cross-reactivity means that if I am a friendly flora, I will stimulate the immune system, I'll boost up the immune system to induce it to produce very low levels of antibodies. I am a bacterium. I have certain antigens or molecules that can trigger the immune system, but they are very weak antigens because I am a weak bacterium. I'm not a virulent one. I'm not a harmful one. So it's a weak antigen, and therefore it would be capable of weakly stimulating the immune system. So when the immune system is weakly stimulated, it produces very small levels or low levels of antibodies. Antibodies against what? Antibodies against antigens. Against my antigens as a friendly flora? No, against the antigens of a pathogen. Whatever pathogen? No, not whatever pathogen, but only pathogens that have antigens in common with me. So cross-reactivity is an indirect way of attacking pathogens. Why is it an indirect way? Because it's not the friendly flora that is killing directly the pathogen, but it is through the immune system. In microbial antagonism, it's direct because the normal flora secrete chemicals that directly attack the pathogen and kill it. And these substances in general are called bactericidal substances. The suffix cidal means killing. So bactericidal substances, what are they? They are chemical substances secreted by the friendly flora to kill the pathogen directly and without interference of the immune system. And you can use these pieces of information to compare and contrast between cross-reactivity and microbial antagonism as we did before. Cross-reactivity is indirect, whereas microbial antagonism is direct. Cross-reactivity involves the immune system, whereas microbial antagonism does not involve the immune system. In cross-reactivity, there are antibodies against the pathogen, but in microbial antagonism, there are bactericidal substances against the pathogen. Now, what are examples of bactericidal substances? We have the peroxides. They are oxides that have molecules that have 2 oxygen atoms instead of 1 oxygen atom in their oxide formula. This is the simplest way you can get it. And we have fatty acids that are organic acids. And in addition to this, we have what we call bacteriocins. What are bacteriocins? Bacteriocins are bactericidal substances secreted by the friendly flora to kill the pathogen. And bacteriocins are considered narrow-spectrum antibiotics. Why are they considered narrow-spectrum antibiotics? So first of all, I have to mention why they are considered antibiotics and then why they are considered narrow-spectrum antibiotics. So they are considered antibiotics because they help kill bacteria. And they are considered narrow-spectrum antibiotics because they kill only a very small array of bacteria that are, which ones? The ones that are closely related to the producing flora. As we said before, lactobacillus, when there are plenty of food debris in the mouth, can cause dental caries. Or what is dental caries? It is a cavity in the tooth enamel or even in all the tooth layers, resulting from dissolution of calcium salts because of the produced lactic acid in acidic fermentation. But does lactobacillus here, by the way, this is a good example. We have mentioned in the second video an example of a friendly flora that has been converted into a pathogenic one, which was the P. acnes that was friendly and that turned pathogenic because of the obstruction of the sebaceous gland. Here also, we talk about another example, which is the lactobacillus that has been converted from a friendly bacterium to a pathogenic bacterium because of the presence of, or abundance of food debris. Those lactobacilli that turn pathogenic will not only cause a cavity in the tooth itself, but will also cause inflammation. So the cavity is not due to inflammation. The cavity is due to dissolution of the calcium salts, perforation of the tooth. But those pathogenic lactobacilli, or those lactobacilli that have turned pathogenic, will cause inflammation in the gums around in the soft tissues and the bones around the tooth. And this is what we call periodontal disease. What is periodontal disease? Peri means around. So a periodontal disease is a disease that affects the tissues around the tooth. Those tissues are the gums and the bones. So part of periodontitis is gingivitis. Gingivitis is inflammation of the gums. Periodontitis is inflammation of the gums plus inflammation of the underlying bone. Meaning that, again, periodontitis is gingivitis plus inflammation and destruction of the underlying bones, and this results in advanced forms into loosening of the teeth. Another pathogenic phenomenon that we can see other than dental caries and other than periodontal disease is the appearance of plaque on the line, the gum line. The gum line is the line that separates the tooth. Here is the gum line. Look at the arrow. It separates the tooth, or it lies at the junction of the tooth with the gums. What is plaque? Plaque is actually a biofilm. It is a thin, wet, sticky layer of microorganisms, mainly the flora that were present in the mouth. Some of them have been turned into pathogenic organisms, and mainly, of course, lactobacilli. Plaque is dangerous because plaque, why is plaque dangerous? Because plaque is the source of all the bacteria that will later on cause gingivitis and bone destruction and periodontal disease. At the beginning, plaque is almost invisible. It's like a soft tissue, soft layer around the tooth. It's not a tissue, by the way, because it's not cellular, but it's a soft layer at the gum line. And if you brush it, if you brush your teeth, then plaque will fade away. But if you leave it for like 3 or 4 days, for 72 hours, 72 hours is about 3 days, then if you leave it for 3 days, then it will be calcified and converted into calculus or tartar. So what is tartar or calculus? It is the calcified plaque. Why does it get calcified? Because there are calcium salts in saliva. They are not present in high concentrations, but they're there. So the more you leave plaque on your teeth or on your gum line, the more it gets calcified and becomes converted into a solid, yellowish, not easily removable substance that is called calculus, and that is calcified. So if you are asked to compare and contrast between plaque and tartar, both are present at the gum line, and both contain a bacteria. But plaque is soft and calculus is hard. Plaque is non-calcified, calculus is calcified. Plaque is not easily removable, plaque is easily removable by toothbrushing, while calculus or tartar is not easily removable by toothbrushing and ordinary methods at home, but you have to refer to a dentist. And finally, a plaque is almost invisible because it's almost colorless, whereas calculus is causes decoloration of the gum line, and it is yellowish or even brownish in certain conditions. What are the bad consequences of plaque? The first bad consequence of plaque is, as we said before, that it can cause gingivitis, not only gingivitis, but periodontitis or inflammation of the tissues around the tooth. Why? Because plaque contains the bacteria that cause the inflammation. Number 2, plaque can cause indirectly tooth cavities. Why does plaque cause tooth cavities? If you're ever asked to justify, plaque is often associated with tooth cavities because it contains the lactobacillus that, after having turned pathogenic, would cause this dissolution of the calcium salts in plaque. Plaque can also cause calculus when it is calcified. Plaque can cause bleeding gums because of the severe inflammation. When plaque causes gingivitis, all these evil things are caused by the bacteria in plaque. So if I ever ask you to justify A or B or C or D or E, they are all related to the bacteria that are present in plaque or to the lactic acid produced by these bacteria. So it is either the bacterium itself, like in gingivitis or in gum retraction or in bleeding gums, or it is the acid produced like in tooth cavities. So when the gums are inflamed, they become friable, and when they are friable, they are easily torn, and the blood vessels are easily torn, and they cause bleeding gums. Why gum retraction? Because when there is severe inflammation in the gums, there is also a parallel inflammation of the underlying bones and bone destruction. So the density and the volume of the bone decrease, and there is like lowering and retraction of the gums. The tooth becomes less supported, and this results in loosening of the tooth. I have just explained this comparison and this contrasting between plaque and calculus, but here I'll talk about the bicarbonates. We all know that in saliva we have sodium bicarbonate salts, and these are they make saliva slightly alkaline, and this slight alkalinity is important because, number one, it neutralizes the lactic acid that is produced by lactobacilli and the lactic acid that is associated with the bacteria in plaque. And number two, whenever there is tooth decay, so it is partly protective by neutralization of the acid, and partly after dental caries occurs, it might help in repair of only early cases of tooth decay by neutralizing the acid. Of course, I might ask you about the characteristics of healthy gums, and the characteristics of healthy gums include essentially that they are pale pink, they are not inflamed, and therefore they are not red, they are pale pink, they are not swollen, but there is no retraction of the gums, and therefore the length of the tooth or the height of the tooth is normal. There are no pockets, because when the gums are retracted, pockets are formed. So if I ever ask you about the mechanism of pockets, it all starts with plaque and the bacteria in plaque, and then inflammation, and then gum retraction and formation of spaces in between the teeth. Why are pockets dangerous? Pockets are dangerous because they are homes for or shelter for bacteria. So they help proliferation of bacteria because they harbor a lot of bacteria and a lot of food debris. Of course, at the gum line, it's clean. We cannot find plaque. We cannot find tartar. There are no pockets or spaces between the gums and the teeth, and there is no bleeding. What are the functions of gums? Gums contain blood vessels and nerves, and therefore they provide the pulp of the tooth, the living part of the tooth, with oxygen and with the fuel or glucose or the nutrients that will be broken down to give energy. And the blood vessels are not only useful to provide oxygen and nutrients, but also to wash away waste, because you know that the accumulation of waste can cause a lot of trouble. And the gum also contains nerves. Is it important to have nerves? Yes, because nerves allow you to detect the earliest signs of tooth decay in the pulp, and therefore they help you to go to be treated and save your tooth. And the gums, of course, provide mechanical support to the tooth. 1 and 2 are functional support or physiological support, but number 3 is an anatomical or mechanical support to the tooth. Now, as we said before, periodontal diseases are diseases affecting the tissues around the tooth, namely the gingiva and the underlying bones. Periodontal disease has 2 stages. In general, broadly speaking, we have a first stage, which is just inflammation of the gingiva or gingivitis. Gingivitis, it has has actually the 4 cardinal signs of inflammation: swelling, redness, warmth, and tenderness. And we have the more advanced stage, which is periodontitis. But periodontitis is a very broad term, and we're going to divide it on the next slide into moderate and advanced, early, moderate, and advanced periodontitis. In advanced periodontitis, or what is the process that is gradually occurring in periodontitis? Because it all starts at early periodontitis and then proceeds through intermediate periodontitis until we reach late periodontitis. So the process is inflammation resulting in pulling away of the gums or retraction of the gums, diminished density of the bone or deterioration of the bone, and therefore loosening and falling out of the tooth. These three sentences might be very suitable to be an answer to explain the pathogenesis of loosening of the tooth. Pathogenesis means what? Means how the disease occurs. So how does loosening of the tooth occur? You will mention these three steps. And these are the steps of periodontitis. At first, we have healthy gums. They are pink. They are not swollen. They are not retracted. There are no pockets. There is no plaque. I might give you this picture and ask you what indicates you that this is a healthy or those are healthy gums. And then all of a sudden, we have plaque that appears. And since plaque contains bacteria, the bacteria will cause inflammation of the gums or gingivitis. But up till now, we don't have retraction, we don't have pockets. And then gradually, plaque becomes converted into calculus. It becomes harder, more calcified, darker. Gum retraction occurs, resulting in the formation of pockets, and there is inflammation of the bone underlying the gums, resulting in bone destruction, and this is moderate periodontitis. We can consider this stage of gingivitis as early periodontitis. And then finally, so we have early periodontitis, and then intermediate periodontitis, and then advanced periodontitis, in which you have deeper pockets, in which you have more advanced bone loss, and therefore the tooth becomes less and less protected, and there is the risk of loss of the tooth that has been loose for a long period of time. Of course, as you know, structure of the tooth is very important, and you're going to have a diagram on the structure of the tooth. The part of the tooth that lies above the gum line is called the crown, and the part of the tooth that lies below the gum line is called the root. So this is the first division, or the first way of dividing the tooth, above the gum line and below the gum line, and these will be labeled on one side. On the other side, we will label the three layers of the crown, which are actually almost the same as the three layers of the tooth in general. So the outermost layer is the enamel, the middle layer is the dentine, and the innermost layer is the pulp. What is enamel characterized by? Enamel is the outermost layer. Enamel is the hardest tissue in the tooth, not only the hardest tissue in the tooth, but the hardest tissue in the body, even harder than bones. It is the most calcified. It is dead because it does not contain nerves or blood vessels. Dentine is the middle layer. It is less hard. It is less calcified. It is living, although it contains a few blood vessels and nerves. By the way, there is a very important justification question here. Spread of dental caries is less rapid in enamel than in dentine because enamel is harder, more calcified, and therefore it is more difficult for lactic acid to dissolve the calcium salts in it. Another justification question is dental caries in enamel is painless, whereas dental caries in dentine is painful. This is because in enamel, we don't have nerve fibers, whereas in dentine, we have nerve fibers. But still, we can have a third justification question. Dental caries in dentine is less painful than in pulp because pulp is more rich in nerve fibers. Pulp actually is the innermost layer of the crown, and it is a living tissue, of course. It is the richest in blood vessels and nerves, and if the acid of dental caries reaches the pulp, then it is extremely painful. See, because it is connected to the main nerve that arises here or that appears from an opening which we call the root end opening. Why? Because all this is the root of the tooth. So the main part of the nerve lies essentially in the root of the tooth. In the root of the tooth, or the part of the tooth that is below the gum line, that is inserted into bones, we have three layers again. We have the pulp, which is the innermost layer. We have the dentine, but we have what we call cementum. What is cementum? Cementum is the outermost layer of the tooth under the gum line, and it is nothing but the continuation of the enamel above the gum line. Meanwhile, we have the periodontal membrane, and the periodontal membrane is the extension of the gum below the gum line. The mechanism of tooth decay we've mentioned before, and we have mentioned everything that is related to that slide. So in order to avoid having a very lengthy video, we will skip that slide. Now, what are the complications, the late complications of dental procedures? If you go to a dentist, then most probably you will have an injury in your gum. Even if it's a minor injury, by the instrument itself, by the tools themselves, or by a tooth extraction, or by the procedure of cleansing or whatever thing. So these wounds breach the mechanical barrier and allow microorganisms, mostly streptococci, that were originally a part of friendly flora, to be intruded in the blood and change their habitat. They get scared and they change their behavior into pathogenic flora. They circulate in blood and then they settle in new habitats that are not their normal habitats. They settle on the connective tissue of heart valves. The heart valves are like doors, connective tissue doors or doorlets that regulate the blood flow between the atria or upper heart chambers and the lower heart chambers, the ventricles. They can also settle on connective tissue in your knee joint, or they can settle under your nails and in the kidneys. What do they do? In the heart valves, they cause deformity of the heart valves, and they cause heart diseases. A very famous heart disease, which we call subacute bacterial endocarditis. A subacute disease is a disease midway between acute and chronic. We mentioned chronic with acne vulgaris, and acute is exactly the opposite of chronic. It has a sudden onset, very severe symptoms and signs, and usually a short course. So what is subacute? It is something in between, midway between acute and chronic. An endocardium is the inner lining of the heart, the inner smooth connective tissue lining of the heart, because the bacteria, the streptococci that were introduced by the dental procedure in blood, will settle on the heart valve, on the endocardium, and cause inflammation. There are four cardinal manifestations of SBE, or subacute bacterial endocarditis. Of course, as we said before, joint pain, because the bacteria settle, or parts of their antigens, actually. It's mainly an autoimmune disease. So part of their antigens settle on your knee joints, part settle in the kidney and cause bloody urine or salmon-colored urine. Some of them settle under the nails and cause rupture of a few capillaries under the nails and cause the splinter hemorrhage. And in general, just like any autoimmune disease, they cause flu-like symptoms with a very low grade fever and generalized body ache. And now we move on to the gut microbiome. When we talk about the gut, we are actually talking about the digestive system. So we are talking about the esophagus, the stomach, the small intestines, and the large intestine. In the esophagus, we only have very few microorganisms that are carried from saliva or with saliva and food, because all the time we have peristalsis that washes away. So it is mechanically actually protected against like settling of flora. In the stomach, the pH is very acidic. So if I ever ask you, why are there very few bacteria in the stomach? Because the medium is acidic and because the medium is unfavorable for most of the organisms there. But I might ask you a third question. What are the organisms that are most probably or that are most likely to be found in the stomach? So you can say, for example, lactobacilli and Helicobacter pylori. Lactobacillus is essentially a good bacterium or a friendly flora in the stomach, whereas Helicobacter pylori is a pathogenic organism. Why do we say that? It is essentially a pathogenic organism, meaning that it hasn't turned pathogenic. And Helicobacter pylori causes all symptoms of inflammation of the stomach, gastritis, namely nausea, vomiting, diarrhea. But on the long run, and because of chronic irritation and inflammation, it might cause a gastric ulcer and then a gastric cancer. Not only gastric cancer and ulcer, but also duodenal ulcer and cancer. And this is how Helicobacter pylori look like. Of course, the composition of the gut microbiome is variable in human beings, just like it is variable in the gut, just like it is variable everywhere. And it depends on your genes, on the way you were delivered, on the way you were fed, and so on. Now, one of the most important beneficial gut flora are flora present in the small intestine and the colon, which are the bifidobacteria. Of course, as you know, we previously mentioned that we acquire gut flora through suckling, not through vaginal delivery. Vaginal delivery gives skin flora. Gut flora is acquired through breastfeeding. So people who are not breastfed have less diversified gut flora. I might ask you to justify this. They have less diversified gut flora. Why? Because of two reasons. First of all, they didn't suckle, and therefore they didn't get the nipple flora. And number two, breast milk contains growth hormone, and growth hormone, a growth factor, not growth hormone, a growth factor. And that growth hormone helps enrich bifidobacteria, increase the rate of reproduction, and help them grow. Bifidobacteria thus are abundant in breastfed infants, and the justification is what I have just said. But why are bifidobacteria useful? Number one, just like any other friendly flora, they occupy space. Number two, they secrete chemicals to inhibit growth of many harmful bacteria and yeast. So they essentially do the four things. They produce useful chemicals like vitamins and fatty acids. They occupy space. They undergo cross-reactive or carry out cross-reactivity and bacterial antagonism. But in addition to this, we have those specific functions. They improve mineral absorption of iron, of zinc, of copper. They diminish absorption of toxins in general, and they reduce the absorption of liver toxins, in particular, like amines and ammonia. They produce B vitamins, folic acid. They diminish absorption of cholesterol from the gut, and therefore cholesterol does not reach the blood, and this is a good thing to lower blood cholesterol. They diminish food allergy. They restore the friendly flora because they multiply rapidly, and they are immunomodulators, meaning that they adjust the response of the immune system, and they absorb procarcinogens and prevent them reaching the blood. Procarcinogens are substances that can cause cancer. So they produce vitamins B and K, they prevent colonization by other bacteria, they talk to the immune system. All these are useful effects, not only of bifidobacteria or of all gut flora, with the exception of bacteroids. What is bacteroids? Bacteroids are a group, or what are actually bacteroids? They are like anaerobes, they produce carcinogens, they produce procarcinogens, and they cause cancer colon. And the more you eat of proteins, especially preserved ones, the more bacteroids flourish. If you take an antibiotic or if you take an unbalanced diet, why is this harmful? This is harmful because it disturbs the normal ratio, as we said before. It causes disturbing the normal ratio of friendly flora to pathogenic flora. Can also be described or expressed as a population shift. Why does this occur? Because when you take an antibiotic, you kill all the friendly flora. So there is a huge space or a free niche that appears in your gut, and at the same time, you diminish your local immunity against pathogens, so pathogens take over. We will stop here, and then we will, inshallah, we will have very soon the fourth and last video. Thank you, guys.